This segment is brought to you by Busamed MDF Private Hospital.
A pap smear, also called a pap test, is a routine screening procedure for cervical cancer. We are joined by Dr. Rockson, who's going to give us more information. Dr. Rockson, thank you for joining us on Living Your Best Life.
It's my pleasure. How are you?
Very well, thank you. So today we're going to talk about what a pap smear is, but maybe just enlighten us a little bit more.
Okay. So a pap smear, like you mentioned it very correctly, is a screening test that we use to isolate patients who may have cancer. That's the worst case scenario, or any lesions or infections that may lead up to cancer. So performing the screening test doesn't mean that I'm witch hunting for cancer. And this is very important for patients to know. We are just checking. Sometimes it's to make sure that you are okay, and we say, all right, we'll see you in a year. So what do we do in a pap smear? It's basically me using a brush, and onto the cervix, I brush those cells and take them off to the lab so that the pathologists have a look at them. There's a lot of information that I can get from the pap smear. One, any infections, it could be any candida and not always an STD. So any change in your vaginal flora, your intimate areas. And two, any cells. And these cells can be atypical, it could be inflammation, it could be any changes that are related to also HPV, which we'll discuss much later, to the worst case scenario, which I said would be cancer.
At what age should a woman or young lady start going for these pap smear tests?
Okay, so we normally recommend that a patient or a young woman starts getting pap smears 3 to 4 years after her sexual debut. So unlike the national health guidelines that say that a woman should only start getting screened from the age of 30 and every decade after, that's an inadequate way of screening. So I tell my young ladies, if you are sexually active, we count 3 to 4 years post your sexual debut, and then we start screening. We don't normally do it in teenagers because obviously they're still growing. So that's when we start doing the pap smears.
I think there's a lot of stigma attached to actually going for a pap smear. I think people think it's really very painful. Tell us the truth.
Absolutely. Look, I mean, it's very horrible historical background. And as you know, I mean, from a long time ago, men have been gynecologists. Women have it in their minds that men are usually rough. And even the instrumentation that we used back in the day was actually metal speculums. But it's a very non-invasive procedure. You lay down, you're comfortable, and the doctor speaks to you. So it's painless, absolutely painless. If at all, you will feel pressure. But most of the time, patients who have pain are those that have other pathology. But it's absolutely painless. In my practice, it takes me 2-3 minutes to do a pap smear.
So once you have the pap smear in your rooms, what then is the procedure and how long does it take to get your results?
Okay. So, I mean, you know, there's a difference between state and private. I'm in the private sector, so I've got all the amenities at hand. I can do a pap smear today and you can get it in 3 days. So what I say to my patients is that I will do the pap smear. So when I perform the pap smear, I obviously brush the cervix, send it off in a liquid-based cytology. The beauty about that is that I've got your DNA on it, so it can check for HPV infection, which is the virus that causes cancer, and I also get to see any other infection in cells. So once I send it off to the lab, it takes about a week for the turnaround. So I have a hard copy, but I usually have that on my phone 2 to 3 days after doing the pap smear.
Okay, so apart from cervical cancer, what other conditions can this test for?
So besides checking for cervical cancer, there are so many other things that I can pick up by just doing a cervical smear. I will be able to tell you how the pH in the vagina is because I get to see if there's a shift in the vaginal flora. By that I mean the change in the different bacteria that we have in our bodies. I can also be able to pick up if you've got candida infection, which is the yeast infection. And also there are certain things like polyps that we don't routinely check for, but I will be able to pick it up and they'll say there is a polypoid, growth on the cervix. So that's the advantage.
So what advice can you leave our viewers with today, the females obviously?
1, make sure that you research your gynae, very important. It's an intimate area examination. So you want to feel comfortable, and if you're not comfortable, it's going to be painful. because it's all in your mind. 2, it's a very simple life-saving procedure. So cervical cancer is a very deadly disease, and unfortunately, if I catch it at a very late stage, I cannot really be able to help you fully. But it normally starts as a progression, so there's a number of years that pass before you develop cervical cancer. The other thing that I find patients are scared of is that when I do a pap smear, I'm going to find cancer. Absolutely not. Even if I find an abnormality, I will be able to deal with it right there and then, and it doesn't always equal drastic measures. And then cervical cancer is a disease that when you start getting symptoms, just know that we are at the very end. So it's better to prevent than to start curing.
Absolutely. Well, thank you so much for joining us today.
Such a pleasure.
Busamed Modderfontein Private Hospital offers more than exceptional clinical care by bringing our company values of accountability, friendliness, respect, integrity, and quality care to life. Busamed Modderfontein Private Hospital offers their patients and their visitors the ultimate Busamed experience. Premium care, personal touch.